I really have the distinct honor of welcoming Marc Schenker, who's visiting us from California. Marc's a distinguished professor and the founding director and current co-director of Migration and Health Research Center at the University of California, Davis in UC Davis, who's going to be talking to us about migration and health, a U.S.-Mexico binational perspective. And Marc, before you come here, if I just may add, like really Marc is one of the strongest advocates of Mexican-American relationships and has done a tremendous amount of work throughout his life in bettering and improving the health of migrant farmers in the U.S. So it's really, truly an honor to have you here, Marc.
It's really my honor to be here and speak to this group and speak on topics that are so near and dear to me. I feel like I do have the biggest challenge taking on immigration, which is the most politically sensitive issue probably covered today, and also maybe the most complex and the most dynamic. Let me just start by asking a question. How many people in the room are immigrants born outside this country? Wow, maybe a third, quarter. Now keep your hands up. How many of the remainder are the children of immigrants? Have one of your parents who are immigrants? Okay, so we're well over half the room. This is a topic that relates to all of us, and I'm going to try and cover it broadly and then hone in on a few specific things, but it's a big issue that I couldn't possibly cover in its totality. Okay, I want to start with some basic principles of migration so we're all on the same page. And the first is that migration has always been and will continue to be a natural phenomenon for living species. It's always been this phenomenon. And it's not only that it's a natural phenomenon, but it's huge. Up to 1/7 of the global human population is migrant. 1/7, 1 billion people live outside their home where they were born. So, you know, this is a normal phenomenon. I was recently in Tanzania looking at the origins of humankind coming out and migrating north and east and west. It's our history. It's what we do as a species. Now, many of us are familiar with these maps of migration, and, you know, here's North America, migrant streams coming up from Mexico, going to the east, the west, and central United States, some into Canada. But what struck me when I saw this map was turning the page and realizing this wasn't human migration, this is animal migration. The beautiful monarchs, the sandhill cranes who fly north and south, often for many of the same reasons that humans migrate, climate change, seasonal factors. The difference, of course, being they just fly right over the wall. They don't have to have a visa. They don't have to have papers. They don't get harassed. But it illustrates the normalness of migration, and so many animal species migrate, and as do humans migrate. Well, I'm going to talk a little bit about the major causes of migration, but they continue and are increasing, and you know, there's been a 4-fold increase in global migration compared to 50 years ago. This is, again, something that changes with time, but it's a constant, and I'm going to get into some of these factors so we're all seeing this together. But first, I just want to remind us that the United States is a nation of immigrants. It's our history. It goes back here, going back to 1850, we can see the percent of the population in the U.S. that was immigrant. And it's varied from 5% to 15, 20% over our history, but it's a constant. It's who we are as a people. And, you know, we can't forget this as we get into these difficult political times. So, the major causes of global migration are likely to increase in the future. And what are those major causes? Well, the first one is natural disasters. These are defined as biologic or geophysical or climate related. And this has been a year of natural disasters and driven migration. But, you know, these are a constant. In Indonesia, the Christmas earthquake and tsunami, killed 200,000 people and displaced 2 million people who had to move because of the devastation of that event. Haiti, the earthquake in 2010, and then just this past year we had the Houston flooding and the Caribbean hurricanes devastating Puerto Rico and the Virgin Islands. All of these are a constant, but not only are they a constant, well, let me just say that they also relate to Mexico, as Mexico can be hit by tropical storms and by drought and by flooding and extreme events, earthquakes. So they relate to the general theme that I'm covering of Mexican-U.S. migration. The prediction is that these will increase to 200 million globally by 2050. And if this year or this past year is any indication, this is not a surprising factor. There are already Pacific Islands being depopulated because of rising sea levels. So this is one of the major factors of global migration, and it's one that we expect to see an increase. Okay, the second major cause of global migration is political change or refugees, and this is interesting. Of course, the major refugee challenge of the planet these days is North Africa and the Middle East and the migration generated by that, but this has changed over time, and we've had periods of large amounts of Asian migration and refugees, and of course we have the Central American countries which are sending immigrants up through Mexico, making Mexico both a receiving country and a sending country for migration. But refugees are a fact of global migration, and the data are that this has been increasing over time as well. But these two causes of global migration actually are small compared to the major cause that makes people move around the planet. Anybody want to guess what that is? Economic. That's why people move in large numbers. They move for work, for income. And associated with that are demographic disparities. So economic disparities and demographic disparities. And I like to illustrate this factor by this graphic. This is a Oaxacan farm worker. Working in California, he will earn in an hour about what he would earn in a day working in Mexico if the work existed there. So there's the push being that the work may not exist in Mexico, and the pull being the higher income that he earns in California as a farm worker. Now, let me just, I don't have time to get into it, but the source of migrant farm workers from Mexico to the U.S. is shrinking as we speak. In fact, that brings up the question about the net flow of migration between Mexico and the U.S. Which way is it greater? Anybody? Mexico to the U.S. or U.S. to Mexico? How many think it's greater U.S. to Mexico? How many think it's greater Mexico to the U.S.? How many don't have an opinion? Well, it's clearly greater from the U.S. to Mexico. Net migration is more going from the United States now to Mexico. And this just illustrates the dynamics of anytime we talk about migration. And the implications for this are enormous. The estimate is that 7 million people will migrate from the United States to Mexico in the next decade. 7 million people. I mean, this is really changing the picture when we think about U.S.-Mexico migration. So the demographics, there are about 240 million people in the world who live outside their country of birth, the largest receiving population being in the United States. But there are 750 when we include transnational and internal migrants. And internal migrants often move for the same reason, finding work, moving from rural to urban areas, In fact, in China, there are as many internal migrants as there are global transnational migrants. But there's also the demographics of migration that we need to think about, and this directly relates to the U.S.-Mexico story. And to put it simply, the population in the developed countries with the jobs is aging and has shrinking birth rates. And the only way to fill that deficit is by migration. So immigrants provide younger population, they provide a workforce, you know, this makes this global picture of migration function. We have movement based on age and demographic differences, based on work need, that's how it goes. Now, an important part of this global migration picture is remittances. The World Bank estimates over $500 billion are sent in remittances. This is money sent by migrants home to the family. This is huge. 38 countries, it's over 10% of their gross domestic product. I was recently in Nepal. A quarter of their GDP is from migrant remittances being sent home. Now, what I love about remittances is not only that it's bigger than global foreign aid, but it's real aid. It goes family to family. It puts food on the table, clothes on the back, housing. It's not buying military equipment and doing big public works projects. It's really what we need to be sending money around the world to do, and that's what the remittances in the migrant story do. Okay, well, on to other major principles. There are negative impacts on health, and these occur in the country of origin, in the transit, and in the destination. And when we think about migration, we have to think about the impact on the country that's losing a population of workers or educated. We have to think about the hazards of the transit, and we have to think about the impact on the migrants in the receiving country. There are a lot of factors, and I could go into this if I had time, but what I want you to do is to just visualize migration as not just a one-way ticket, but a circle that impacts the countries of origin and the receiving countries. Well, what about our southern border? There is an average of 1 death per day of migrants crossing the southern U.S. border, or 10,000 deaths since 1994. This is tragic, and it's unnecessary, and it's one of the sad realities of migration. And of course, this number pales compared to the deaths that are occurring in the Mediterranean with migration, where we're seeing thousands of deaths per year in that migration story. And just this past year, we had this tragic event in San Antonio where migrants were locked in a trailer truck. 9 died and several were injured as they were in the Texas heat. It's one of the sad realities of migration. I won't say any more about it, but we'll leave it at that. Okay. We've been hearing about social protections and health reduced for the majority of immigrants, less preventive or public health care, less financial resources for health care. Migrants may be excluded from health care access, such as in the Affordable Care Act, where if you're undocumented, you can't even buy into the exchanges. Workers' compensation discrimination. This is one of the health realities of migration. And I put in just a couple graphics about this, but what I want to emphasize, we've been hearing today about Latinos as a group. It's a very diverse group, and you can separate this group into recent immigrants, long-stay immigrants, Mexican Americans, and compare to Anglo. And if you do that, what you see is a range, with usually the worst situation being for the recent immigrants, such as here where we're looking at connection to a healthcare facility. These are data from California, but I'm sure applicable elsewhere in the country. And 42% had no connection to a healthcare facility of recent Mexican immigrants, compared to Mexican Americans who had only 15%, much closer to the US-born whites. Similarly, levels of no medical visit, highest for recent Mexican immigrants. Longer stay immigrants have a lower level, Mexican Americans lower still, and the lowest level of no medical visit in the past 2 years for US-born whites. So the point is that immigration separates out the Latino population in terms of these outcomes that are very relevant to health and health care. And finally, emergency room visits, the same pattern, lowest among recent Mexican immigrants and among Mexican Americans, similar to the US-born white rate. I'm not going to talk more about health and healthcare. You've heard about that already, and you're going to hear more about that. But I do want you to think about the variable of immigration status, and that separates out the immigrant population. Okay, so there is good news. This has been mentioned already, the MMWR report, that Hispanics had better health outcomes than whites for most analyzed health factors, despite facing worse socioeconomic barriers that they do. However, there are the diseases we need to think about: diabetes, obesity, chronic liver disease, homicide, which have a higher prevalence. And these are things we need to focus on when we think about the health of this population. And again, bring in this immigrant variable and realize that the population is not homogeneous. So these are data from the study that I did that really got me interested in immigration and its impact on health. I was doing a study looking at the so-called Hispanic reproductive paradox. How is it that Latinas come to this country and have better pregnancy outcomes than native-born, and that worsens over time when they have less health care, less factors that should be making that happen? And so we recruited 1,000 Latinas into the study out in California, and at a first prenatal visit, and followed them through to pregnancy outcome. Now, about a quarter of the population was US-born and 3/4 were Mexican-born. And before we even looked at the health outcomes, we looked at these behaviors in the two populations, the US-born and the Mexican-born. And for every one of these, whether they ever drank alcohol, drank during pregnancy, smoked cigarettes, smoked during pregnancy, ETS, environmental tobacco smoke exposure, or drug use, every single one, the US-born, showed a worse profile. And this has been shown in other studies as well. And I started thinking, geez, this is huge. I mean, here's all these factors that we know have an impact on health, and we're seeing this dramatic change in one generation from a more healthy profile to a worse health profile. On average, for just cigarette smoking, Latinas smoke 4 times as much after one generation in this country. So the implications of this really struck me, and that's what put me off in this direction to say, I need to be looking more at immigration as a factor in its own right and its impact on health. Well, my own research has been on immigration and occupation, and I'm going to just talk about this subject briefly and then wrap up. Here we see employed Latinos in the U.S. by industry, and for women, the largest is housekeeping, maintenance, and then the next 3 industries are crop agriculture, construction, and transportation. Now, on this slide, what we see are occupational fatality rates. And if you look at the top 3 bars, on the right, the blue is the occupational fatality rate, and you see construction, transportation, agriculture as being 3 of the highest. The 3 that were the most dominant for Latino workers in this country. So they work in the most dangerous industries, and that's part of the disparity that I want to highlight. But the story is even more significant. And on this slide, the solid bar shows you the overall occupational fatality rate in this country, and it's been going down, mostly because our most hazardous industries have left or disappeared. But the bars, the boxed line, shows the rise in percent of fatalities to foreign-born workers. And what we're doing is we're shifting the occupational fatality burden to our foreign workers, in part because they work in the most hazardous industries, but for other reasons as well that I'll get into. And this is the reality in my world of occupational health. The dangerous jobs have gone to the immigrant workers. Now, that finding is emphasized by this study, which used the American Community Survey, which is a survey done every 10 years based on the census of several thousand people representative in the country. And you see and this is multiply adjusted data, for every comparison, injury rate or fatality rate by industry or by occupation, for every comparison, the rates are higher for the immigrant workers. So it's not an isolated phenomenon, it's a generic phenomenon that we're looking at. So why do immigrants hold riskier jobs than native-born? Well, this is a difficult, complex question. They work in more hazardous industries. They may have different perceptions or knowledge of job risk. It may be related to education, to language ability. They often have fewer alternatives, but the one consistent finding is this one. It's precarious work, or the precarious job, which is highest for the undocumented immigrant. This is the individual who's not going to complain about conditions on the job, who knows they have to do the job, or they're going to lose work, or maybe even be deported, and they continue. And the result is the hazardous outcomes and the higher injury and fatality rates that I've been showing you. So the findings are clear in terms of occupation. The hazards are worse for the immigrant worker. I want to end with a story and a slightly different take on addressing this problem. I've presented you a lot of statistical data, but this is a story of a reporter, Sarah Neer, who is a reporter for the New York Times. Sarah, like good New Yorkers, went and got her mani-pedi and became curious about the people who were in the salon, in the nail salon. How was it that they were available 24 hours a day? How is it that they could do this for $19? And she started talking to the nails painters, the stylists, and, hearing their stories. And of course, as you're there, with your nails being painted, you can talk and really become very personal. And what she discovered was an abusive industry of these nail salon workers, that many had to work for several months without any pay, that they were underpaid, that they worked with the hazardous chemicals and toxins that exist in nail salons, that it was really mistreatment, abuse of this whole population of immigrant workers. And the workers in the salons are Asian and Latina who do this in New York. Well, Sarah, being a New York Times reporter, had a bit of a mouthpiece. She did a 9-month investigation of this, and the result was published in the front page of the New York Times. Well, that's a nice media to have. But what was the result of her study? Well, she got a lot of attention. There were customer boycotts, worker protests. 1 week later, Governor Cuomo announced a plan to protect nail salon workers. The salons were fined $2 million, and later Governor Cuomo announced that all salons have to have safety ventilation to protect them from harmful chemical exposures. Basically, shining a light on this industry led to real results. And that's the message that I want to get across, is that this one person who thought something wasn't right was able to follow it up with an investigation, use the media to get attention and to make change. And there's several other examples of this I don't have time to go into, where people are, using media, social media, investigative reporting, to highlight the abuses that go on, and sometimes to embarrass big multinational corporations who don't want the bad mark on their name and are going to do something to improve conditions of the workers. So let me end with the theme that I started with, which is the humanization of migration. We live in a time where there's demonizing of migrants and migration, and, that's wrong. And we have to resist that. We have to fight that. There are not only the social justice issues, but the health issues that I've been talking about. And John F. Kennedy wrote a book called The Nation of Immigrants. He said, every ethnic minority in seeking its own freedom helps strengthen the fabric of liberty in American life. Similarly, every aspect of the American economy has profited from the contribution of immigrants. That was true then, it's true today. We need to perpetuate this message and resist, the politics of evil and anger that exist. For anyone interested in doing research on this topic, I'm one of the co-editors of this book from the University of California Press, Migration and Health, a Research Methods Handbook. It covers quantitative and qualitative research methods, as well as cross-cutting issues, such as language and culture and participatory research and so on. And, let me say, research in this area is not easy. It's challenging, it's different, but in my opinion, it's where we need to be putting our effort because it's where the disparities are. So thank you very much, and it's great to talk to you.